I'm Ed Connors, founder and CEO of Heudia Health. Thank you for joining us today, and thank you, Rosemary and Cody, for including Heudia in today's activities. Heudia is a technology-driven health services company. We're operating at the intersection of mental behavioral health, social determinants, and machine learning. Our technology platform, AccessMeCare, acts as a virtual social worker to do what we would all do for a friend, family member, loved one in a health and social crisis, help them identify their needs, determine what providers and service organizations are in their area who could best help them, and then empower them to overcome their barriers to care. We are proactively increasing access to care while reducing costs for payers, healthcare providers, and patients. The platform is developed, it's in the market, we're revenue generating, and it presents a very compelling business opportunity. The target market is $25 billion. We've launched AccessMeCare. We've got very strong evidence of product market fit across the broad area of customers and environmental settings, rural, urban, suburban as well. We've got a series of patentable innovations that we're ready to move forward with. If you really think about what we're accomplishing here, social determinants has been plagued by the fact that you have a number of one-off solutions. You have certain companies that are working with data analysis. You have other companies that are doing assessment tools. You have other companies that are resource directories and referral systems. But what lacks in the market is one platform that anybody can use off of the web or mobile and address everything. So when we go into a community, we're doing a data analysis using an evidence-based system of care. We're helping people do assessments, again, provide decision support. So more people are using the appropriate center of care. Moving forward, we got an incredible opportunity to expand our work through internet IoT solutions, where we've started to break into the market around community health kiosks, and now getting into a more empowered recommender engine so that we can really guide people to the most appropriate center of care to reduce cost in the environment for our customers. So imagine the systemic benefit that would happen if everybody had access to what they need to connect to care. And one of the greatest experiences we had was when we were first deploying AccessMeCare with a hospital, where we had an older woman with a 6-year-old child say, "I need to find glasses for the boy." And ultimately, within 90 seconds, she was talking about how she had a cancer on her nose, didn't know where to go, didn't know what to do. And that sets up the basic use case for the platform, the ability to meet anybody where they are and to proactively guide them to the right place and help them overcome their real barriers to care. And in this case, it was income, insurance, lack of knowledge because they didn't know where the hospital was with the new cancer center, and then they had to overcome their fear, which they were able to do in discussions with our layperson navigator. So the consequence of people not getting to the right care barriers is huge. A large number of emergency room visits are being charged and are large amount just because people are using the hospital rather than going to the more appropriate center of care, which would be a community health clinic. This is complicating the value-based care space, right? Because the population that we're most interested in, uninsured individuals, Medicaid beneficiaries, are twice as likely to misuse an emergency department and 9 times more likely to have a mental illness. And ultimately, our competitors in the referral space can only connect somebody to health and social services about 15% of the time, leaving 85% of the population to fall through the cracks. Our platform is really a digital health intervention. We launch into a community, we engage a target population, we improve access to care, we improve engagement, and this whole thing transforms the work experience for both the clinical and non-clinical staff as well as for the patient. The thing that's really got Heudia moving forward is the fact that as of January this year, there is new reimbursement codes that allow healthcare providers to bill for the types of services that we're able to conduct and perform through AccessMeCare. This generates about $10,500 of transactional revenue for every 100 Medicare beneficiaries in service with Heudia using our assessment tools. The unfair market advantage is that we launch our platform using a very precise community-based participatory research method that was proven to increase the number of vulnerable individuals using a clinic by 180%, which correlated to a 20% reduction in avoidable emergency room write-offs for the hospital. We've currently got 4 client installations with over 250 network partners. We've had 42,000 platform sessions, largely across rural areas in Iowa and northwestern Oklahoma, North Carolina, and Virginia. 15.5% of the people that use our platform, as an example, in Dubuque, Iowa, use it to self-refer to mental behavioral health care services. We've done a number of different marketing studies, so we know what we get in terms of user engagement right out of the organic growth with no marketing, and then what additional marketing that we could feed into the ecosystem to really generate increased scale and grab those users and get them to the most appropriate centers of care. And we're outperforming our competitors significantly in this space. We've driven a very large number.
Large number.
170 people we connected out of every 100,000 people in Fredericksburg, Virginia. That is more than the entire population that our competitor did in the entire state of North Carolina. So it's a huge market opportunity. We're really focusing in on clinics, hospitals, and then we're going to move into the payer space. So we've got a series of different partnerships in place with assessment tools. We've got 2 virtual care providers, most notably CareTalk Health, that allows us to pair up our services with chronic care management, remote patient monitoring, remote therapeutic monitoring to really add and increase the value of our relationships with our enterprise customers. We've got a very strong team. I myself was nominated for the National Medal of Technology and Innovation for my work aligning the social determinants of health with the needs of medical care. I am supported by our technical co-founder, Marty Fisher, the former president of AOL's technology division. We've got a robust team focused on the machine learning part, as well as Celeste James out of the Mid-Atlantic area coming out of Big Health, and Kaiser Permanente, where she served as the VP of Equity and Population Health and Community Health. So we're generating revenue. We see the opportunity for 5x growth. We're raising a seed round of $1.5 million. We know that engaging individuals through our platform is going to be the primary driver of revenue. That means we don't have to get a lot of enterprise sales sites up and running in order to generate larger amounts of revenue. We recognize that in time will be split between the services, providing health equity services according to the CMS framework, as well as the revenue we're generating through SaaS subscriptions of the platform itself. And then in terms of funding, we're raising $1.5 million seed round, of which we've got $500K pledged and committed. We're doing this under a convertible note or a SAFE with a 20% discount, $8 million valuation cap. The funding of the seed round is really to set staff up, to scale up. A large part of the staffing chart funding is split between technical staff and sales staff, because we need to get our sales organization up and running and on board. That drives us to a $3.5 million Series A round that will follow up nearly immediately after closing the seed round. We are seeing strong exit opportunities, primarily with private equity. We've already been contacted by 3 such firms. We see Medicaid managed care plans being interested in what we're doing, as well as certain strategic partners we've already identified with. The gross revenue exit multiple is 10x. Our goal is to drive the company to $10 million of revenue in the shortest time possible. So we start to see what those exit opportunities are and provide a good ROI for our investors. So once again, we're in a very hot market space. We've demonstrated product market fit. We're generating revenue, and customers love us. We've got really strong referenceable clients and making significant impact in the communities. So thank you all, and thanks again once for the opportunity to present.